Hi, we're going to do a jawline augmentation. It's also called facial contouring. Restylane, Juvederm Ultra Plus, Juvederm Voluma. In really thin skin people, even velour are good options. I don't like radius. I don't like how thick and chunky. I like hyaluronic acid. I'm going to show you a technique. There's a variety of different ways I can do it depending on which area I'm trying to contour. When you say facial contouring, the mid-face, obviously the cheeks come in mind, but sometimes it's really the jawline. We have a beautiful patient. She wants a little bit more definition along basically the jawline, the angle, the mandible, and you'll see my technique. Come on up. There, this is perfect. Little tiny droplets. Doing okay? Mm-hmm. A sensitive area when you're close to the earlobe. Because of all the little tiny pokes, you get a little bit of kind of almost like a dotted appearance, a little lumpy bumpiness, but that just lasts about a day, if that. And we can start to see how we're getting a little contour. You can start to see there's a little shadow that's forming here. And whatever I do, I like microdroplet. I don't like big clumps of filler sitting anywhere. There's no bruises. I also don't want too much width on a woman. I don't want to give her such contour where all of a sudden she just looks like Schwarzenegger. That's not the point. The point is still have a nice feminine jawline, but have a little bit more contour. And you can see you're already starting to get a shadow right there, which is achieving that. Now, we don't want to create too full of a masseter, but a little augmentation is important. If there's a little bleeder, you just hold a little pressure. This area doesn't bruise much. It's rare for this area to bruise. A little bit of pressure maintains it. I'm gonna hold her head so she doesn't fly off the chair. Typically one syringe on each side is all most people need. Sometimes you need a little bit more. Doing okay? Mm-hmm. Good. We've seen some techniques with a long needle, kind of going back and forth. The problem with that is when you use the long needle in that area is you're depositing almost like a worm-like or snake-like strip of filler. And I prefer to have this more natural contour. Looks really good. You have your head this way a little bit. Perfect. Nice and subtle, doesn't look done. Two of those one syringe. The injection's not all the way down to the bone. I want to avoid the parotid gland. I don't want to kind of hit the parotid. So it depends on how thick somebody's tissue is. Some people have thinner tissue, some people have thicker tissue, but I'm staying superficial to that. So that's one side. And then we're going to just hold a little pressure. There should be very little bruising. And if there is some bruising, it's very easy to cover with makeup. I'll go to the other side. So I'm going to give you the mirror to take a look at one side, see what you think, and then we'll go to the other side.
Yeah, perfect.
Yeah? Mm-hmm. When you compare it to the other side, you just kind of lose that definition right there, whereas this side, you definitely do get that chiseled look down there.
Yeah.
Without any big lumps or bumps.
It looks really good.
Cool. So we'll do the other side. gel on my heavy home pressure, and then we'll do this. And we'll just like the wet one feels better up against it. Alright, I'm gonna have your head this way. Good. So, doing the contralateral side, same thing, it's angle the mandible, little tiny pokes, little micro droplets. I'm cognizant of where the jawline should be, where it needs to be. Just tiny injections. You may have seen some people in these videos where they create these videos for Instagram or YouTube, and they take these large protractors they buy from Home Depot or Staples, or I don't know what they're buying from, and they're measuring all sorts of things, and they take these pens and they mark up the face. That's a lot of showmanship. There's nothing that they're measuring really there, but it makes it look good, makes it look like they're actually taking measurements of angles and things like that, and they're not. It's an art. You're gonna have to look at somebody's face. The two sides are different. We gotta see what fits their face. There's no measurement that you're taking from here to here, here to here, here to here. They do all these like fancy stuff. It's just like a magician that uses a lot of props. At the end of the day, this is just simply art. And you're slowly just transforming the area little by little by little. And you can see there's no bruises. Just tolerating it well. It's obviously not the most comfortable thing in the world. I bet you she'd rather be getting a massage than this. But she's tolerating it very well. You got another wet one, please. Cool. And a dry one. Well, two sides are always different, so I turn around and I kind of compare the two sides before I finish completely. Okay, that's straight for me, perfect. Now look at the jawline. Cool. I kind of compare side to side. Tilt your head up a little bit for me. Look at the left, look at the right, tilt it down a little bit. Perfect. I'm going to do a little bit more to the right. That's the side that you need a little bit more. Tilt your back again. Typically the left side of the face is our favorite side. It is a more defined side. On the right side, if we look at cheeks, if you look at cheek injections, things like that, the right side usually takes more. On most people, not everybody. Done. That was 2 syringes. Gives you the exact contour that we like without any masculinization of the face. Just really nice and subtle definition right there, but there's absolutely no augmentation. I don't want to make it look like, again, she has a masculine face. I just want it to look like she has a more defined face. So that's it. A little bit of pressure. And then in 6 months we can add a little bit more to just maintain it.